Hello, everyone, and welcome to a new episode. Today, we're having Negar, and she's doing her family medicine residency at Western University. Negar is one of my friends, and we spend time together preparing for our exams. And she has an incredible story to share with us today. Welcome, Negar.
Thank you. Thanks. Hi, Roupen. Thank you. Hello, everyone. My name is Negar, and I am really glad to be here today.
Nice. I'm so happy that you are here and you are willing to share your experience with everyone. So can you tell us a bit like about yourself? Where did you do your med school? When did you come to Canada? How did you decide to go into medicine in Canada?
Yes, actually, I did medical school in Iran, and I graduated in 2002 from my medical school, and I finished my first residency in pediatric in Iran in 2010. Then I worked 2 years as a pediatrician in Iran, and in 2012, I moved to Canada as a skilled worker with my family.
Nice. So when you moved here, how did you start preparing for the exams? Like, what did you do? I know like many people when they come here, they get overwhelmed with a lot of information and a lot of things. And so what happened at that time?
Yes, to be honest, for me, it took me almost 2 years to convince myself to start doing exams. Basically, as a newcomer to Canada, as you mentioned, I was kind of overwhelmed with the new environment. I realized, even though I thought like my English language proficiency is enough, I realized no, I do have lots of like challenges in that part. And yeah, like even though I wouldn't recommend to any IMGs like myself to do the same, but for me it was a little bit different stories because it took me 2 years to prepare mentally. I'm going to do the exams and I'm going to practice here in Canada as a physician. At that time, I didn't have any view that what field I'm going to practice. I had like pediatric in my mind, which was my primary field, and I obviously I finished my residency in that field. However, I was open to even apply to family medicine. During that 2 years, what I did volunteer work, and it was really a great start for me. Because I did like a very regular and intense volunteer work in Vancouver a stroke recovery center, and it
Wow.
helped me. Yeah, it helped me to get basically settle in the community, to improve my communication skills, to basically meet people, as I mentioned, to improve my basically language, and feel like I'm doing something like productive in addition of basically just studying for exams. Meanwhile, I managed like to basically, because at that time, I would say my personal situation was a little bit different. My daughter was very young, like 1 year old at that time. So my time was very limited, like basically to study, manage like working as a volunteer, and also like taking care of my daughter. So it took me almost 2 years to be prepared for doing evaluation exam, which at that time it was basically the first exam that as an IMG you had to take to be able to like proceed and do the rest of the exams. I did my evaluation exam. I got like a good score, I would say, like on 95 percentile. I know like today we don't have any
Yeah,
like need
EE
for
is canceled. Yeah.
evaluation exam, but yeah, like as a first exam, I took the good score. Then I studied to prepare myself for QE1 exam, and for me it took me almost 1 year, like a gap between my evaluation exam and QE1 exam. Again, I would suggest like it's not really like the best path, but at that time, because of the whole situation, I couldn't really do my exams like in a row. So after 1 year, I did like my QE1 exam. I got like a good score, not really very top score, but like above average for that time, because I know like I knew the score also are very important, and I tried my best. So
Nice.
yeah, yeah. And then afterward, at that time, like back to 2014, 2015, having the IELTS or TOEFL exam was a pre-requirement for doing like the NAC-OSCe. And without
Mhm.
like having your language proficiency test, you couldn't even write the NAC-OSCe. Today, like nowadays, is a little bit different. So again, it took me almost like 6 months to like pass the TOEFL exam. I was able like to get a very good total score, like adequate scores in three skills, but like speaking part, I couldn't really get like more than 22, 23. And I attempt like maybe more than 5, 6 times to be able to pass the TOEFL exam. Yeah, and then afterward, finally, I took like my NAC-OSCE exam. Um, like even though my QE1 and evaluation exam, I actually got like good score. In my first NAC-OSCE exam, I got really like average score, which wasn't obviously enough for basically getting the best chance in CaRMS. So and at that time, unfortunately, like the rule was everybody could take just one attempt of NAC-OSCE, and if you pass it,
Mhm.
doesn't matter what score, you couldn't really repeat it. So for 2 years, I got that basically average score. I applied for CARMS with like those scores, because my QE1 and evaluation exam scores was good. I was able to get the interview for pediatrics 2 years. But for NAC-OSCE, because NAC-OSCE was really directly related and affected your chance for family medicine, I couldn't get any family medicine. So yeah, I didn't really get disappointed. Even though it was mentally very challenging. I should be honest for everybody. It's not really easy, right? It's your time.
Yeah.
Like you have a goal in yourself, and you meanwhile you are realistic and you understand you are not really new grads anymore, and each year would be more challenging, like applying to the CARMS. So that's why from that point, I actually tried to see what would be other options. Like I seek for the research. I got involved in the research for a position. Also, I actually continued doing volunteer job. And for 1 or 2 years, I did like research in pediatrics, which was great experience for me. But I was able to publish like 3 publications with a good group of people. I learned a lot about, again, like a Canadian research system. I think like every year it added like more experience and more better understanding of the system. And Yeah, that's it. And then after 2 years, I was lucky enough that they changed the rule, and I was able to redo my NAC-OSCE. In 2018, I was lucky enough to basically rewrite my NAC-OSCE exam. I was even luckier because I joined a great group study, including yourself. So yeah, we actually practiced a lot, studied together the whole summer. At that time, I actually was able to finish and completed my basically Q qualification two as well. It's not mandatory, but if you can do it and if you can complete it, it would be a bonus on your resume for any application. Yeah, so I was and also I actually started to have job as a physician assistant in Apple Tree Group medical company in Ottawa. It was basically also a great job experience for me. It was really like a good networking opportunity, and also, as I mentioned, better understanding of the Canadian healthcare system.
Wow, that's really inspiring. Like that's like this is really an example of how persistent you are. Like taking care of your family, going through all this, writing the exams, and waiting to like for those people like who don't know, like right now the exams required are the NAC-OSCe exam and the MCC QE1 exam. 3 years ago when I applied, and several years ago when they got applied, there was an exam called the MCCEE, or the Medical Council of Canada Evaluating Exam. It's one of the exams that we were talking about. So yeah, like writing this and writing the QE1, doing fellowship, doing sorry research, some volunteer work, taking care of your family. Like I always told you, like I find that inspiring to take care of your family and continue taking care of yourself and your education. Wow, that's really like great. So maybe we can expand a bit about like the research part. Like, what kind of research do you do back in Iran and here? How do you find those opportunities?
Yes, actually, I had when I moved to Canada, I had couple of publications totally related to my background, like in
Mhm.
pediatrics, which I did during my residency, first residency in Iran. When I moved to here, because I had like in my mind like both options of basically doing another residency in peds or like doing residency in family medicine. Also another option for somebody like me at that time, it was like basically applying for a clinical fellowship in pediatrics. I kind of like basically had all those options open for myself. That's why I actually did the research completely in pediatric. Like two main discipline in pediatrics that actually I worked with them directly was neonatology program in Ottawa and also pediatric nephrology group in Ottawa. I did couple of observership with them after doing some research with them. Basically,
Okay.
initially, I communicated with them that I would like to be involved in some of research projects if you do have any. And then after doing, let's say, like 6 months of research together with all teams, like knowing some staff there, they offered me, if you like, you can do like observership as well.
Nice. So research was your gate.
Yes, some of the observerships were very like short, let's say 2 weeks, 3 weeks. Some of them were longer. Like let's say in pediatric nephrology, I had like the chance of doing 6 months of observership, which was
Wow.
again like really long enough and great experience for me, even being as observership there with the whole team, watching like basically observing other Canadian trainees, their fellows, their residents, even their medical students. It was really great opportunity to learn from them. Um, Even though like after spending those all times actually didn't really reach me to my goal, which was eventually like getting a clinical fellowship. But like right now in hindsight, when I like look at back, I think like those opportunities all like step by step helped me to reach the point that I am here today. So yeah, and another basically I think point that I did like during these couple of years, after 2 3 years I realized that okay, I'm not really new grad. Also like after 2 years being in Canada, I kind of like started to be out of practice, and this is very important factor I think for any applicant. So I actually planned and managed my time every 2 years to 3 years. I back to Iran where I had like the license to practice there independently.
Okay. Yes.
And I took my time, like 4 months, 6 months, anything that was possible for me. I took that time and like basically I kept my recency of independent practice, which I think it was a very important factor. Because as I mentioned, some factors like your age, your year of graduation, those factors you cannot really change them, right? Like
Yes.
everybody has different positions, different stories. But like I try to focus on those factors that I can actually improve them. And one of those things like I managed, I think, and it wasn't really like easy because of the whole situation. Like my daughter by the time like went to school, I had to basically arrange the time that worked for both of us. My husband really couldn't really get off. I had to basically manage like going by myself. Kind of like challenging, but I did that like regularly, especially in the last 3 4 years before getting matched. I tried like almost every year. I went back to Iran and practiced like at least for 3 4 months.
Wow, that's really like great way to look at things. Like you can't control your age, you can't control some things in life, but like you can control other things. And like going back to like, I didn't know this. Like, I'm really surprised that this is really smart to maintain like your recency of practice. Wow, that's
Yeah,
really
I
like,
mean, you should like basically use whatever you have in your hands, right? And in my view, every applicant has its like their own basically strength and weakness in their basically resume. So yeah, like I mean, those are like the belief that I came up after a couple of years, basically spending time in different fields. And yeah, like eventually I actually told myself I have to be honest with myself. I am more clinician, being that like researcher. Both are great options. But yeah, like I wanted to practice clinically, and I think like even working here in Canada as an assistant actually taught me that yeah, like I really enjoy seeing patients. So that's why I tried. And even though I had lots of ups and downs in my journey, I didn't really give up. And I'm
right.
glad that I didn't give up.
Yeah, I'm glad too. Like you are a living example how like persistent can
Mm.
be like it can like you end up achieving your goal. So after like we spoke about like about the research and observership. If you can expand a bit like about the observerships for us ISMGs, especially like if we like did medical school abroad, it's really hard to find observership or like an elective and find people to like work with them and get good letters. Like how do they end up like finding those opportunities?
Yes, as you mentioned, I really agree for some IMGs like myself, including myself, yourself, that we actually did not really do any undergrad here, and we did not really like we actually came here as a graduated trainee, postgraduated trainee. Is not really easy path to find like the observership opportunities. Um, I actually sent lots of emails to maybe more than 100 basically people that I thought like they may actually offer me, and I got like maybe more than like 100 regrets. But as I mentioned, like at the beginning, like doing research after a couple of months, the team that I worked with them as a researcher, they were nice enough. Like when I asked them, they actually offered me those two observership. Couple of other observership that I did in family medicine before my job as an assistant. It was like kind of like communication. Let's say like we had one neighbor who was like a family physician. So after like knowing them, like telling my story, that like sharing that I'm looking for any opportunity, they offered me. They were nice enough to like let me like go to their office, their clinic, doing let's say like 2 weeks, 1 month, anything of observership. So those were like couple of opportunities that actually basically I created, and I was lucky enough to get. But for the last 2 3 years, because I was working as an assistant,
Hmm.
so in a basically, as I mentioned, in a medical clinic, that they were kind of like there were different and several medical clinics, and I was like working with different preceptors, different basically physicians. Like it was like as a job that I did. I
Yeah.
worked in a diabetes clinic program in Ottawa. I was working in with a couple of family physicians in Ottawa, and also I was working with two gynecologists in Ottawa. So basically, in the last 2 3 years, I didn't really do that much observership because already I was working, and I think like that assistant job really helped me with getting more experience with the patients, with the other colleagues, and basically develop that skills that I needed, basically.
Wow, that's really like inspiring. And like you mentioned something, I just want to expand on a bit. You send hundreds of emails, and this is usually like the way for international medical graduates who don't have enough connections. Just like you have to introduce people about yourself, like you have to tell them about yourself, who you are, and sending hundreds of emails. I don't want people to get frustrated. Yes, sometimes it could be hundreds of emails. until we get an
Yeah,
answer for a single one or two observerships. So yeah,
yeah. Even
it's a bit
to be
long process.
honest, even I actually for couple of those observership, even I had to go personally to some people clinic that I didn't even like ever met them. Just a friend of mine like mentioned that last year I did observership here. You may go and ask them. I went there like the clinic were so busy and like I mean it was challenging, right? Like I mean sometimes you would
Yeah,
ask like what I have to do like those kind of things. But yeah, like I mean I did all of them, like not only sent email, like personally I went in person to a couple of clinics,
interesting.
asked them, and most of them it was negative. And I would say at that point it was disappointing. Like even I thought okay, even they don't let me like to do observership with them. But I would say like yeah, as I mentioned, I'm really glad I could pass those basically negative aspects and just focus on what I can do.
Nice. That's a really nice way to look at things. So, like doing observerships, writing the exams, and doing some research. Like, also like one of the things that usually people do, like the extracurricular activities, the volunteering, or like any hobbies. Like, did you do any of those things? Did they help? What's the story?
Yes, personally, I am very sociable person. So doing
Yeah, I agree. I totally
volunteering,
agree.
doing volunteering has been one of my hobbies here in Canada. So I
Nice.
have done lots of volunteering. So I would say like any opportunity of volunteering, I didn't really hesitate to do that. It was kind of like a fun for me to meet other people, to share basically our experiences. One of the most serious one that I did for 2 3 years, it was a stroke recovery center. Such a nice people there. I learned a lot from them, and they really appreciate like my basically time and effort there. Also, I participated in lots of like fundraising in different basically fields that I was, let's say like the time that I was with pediatric teams, they had lots of like opportunity to basically participate in their runs, their fundraising. In addition, I was one of the active member in volunteering in my daughter's school for the last 4 5 years, which was really
Nice.
great. And usually I was one of the parents that at least like once or twice a week I was there to do like volunteering directly in their classroom or in any like other fields that they needed. So yeah, I would say like I enjoyed really doing volunteering job in different fields in Canada, and it was helpful, I would say, basically to show who I am and basically how I enjoy being in a team, basically communicating with other people, learning with them, and sharing our
Yeah.
experiences.
Yeah. Wow. 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 That's really like great. So you wrote the exams, you did the research, the volunteering, the observership, but now after you apply, you get the interviews. So how was it? How did you prepare?
Yeah, as you know, like this year that I got matched, it wasn't my first interview, right? In the last 2 3 years, I applied in a row, and unfortunately, I couldn't get any. So obviously, like every year, you lose your confidence, and this is normal, right? I mean, it's basically challenging, but I actually did my best, practiced a lot. I really asked like any friends that could basically help me to listen to my answers. And I would say I was one of the luckiest person that I had lots of good friends, all of them like successful, supportive. They really like spend time with me, listen to my answers, um, like had a great recommendations for me, like you have to practice, you have to basically be confident, believe in yourself, and basically be honest in your interviews, which actually I tried like to do my best, even though even like this year I wasn't really sure what I'm gonna get as a result, because as I mentioned, it wasn't my first attempt. So another things that I think really helped me this year, I had a great backup plan. This year, in addition of doing CaRMS, I applied to Ready Practice program
Hmm.
in Saskatchewan. and I got like the basically primary acceptance in that program. So I had really strong backup plan this year, and I was sure that okay, if I couldn't get residency this year, I would do my best to go to any other provinces that they offer this ready practice basically program, which is like another basically opportunity for those IMTs like me that they are not really new grads and they have had already some basically experience in practice. So I think yeah, like but thankfully I got matched this year after 3-4 years. But I think they are like if I'm gonna say like what made difference, I would say for sure it's about luck as well, because you don't know like how, it's not really certain the process, and it's really competitive, it's really like lots of good applicants there. But I tried my best, and I think yeah, like I really used my resources very well
It paid
this
off.
year.
It paid off, and you're like living
Yeah,
example of persistence. Like you didn't stop after 1 year or two. No, you kept doing it again and again and again until it worked. So like
yeah,
you're
even
an
though it
example
was
for everyone.
tough. Yeah,
Yeah,
even though it's not easy. Like right now, I smile, but when you are at that point, it's not easy. It's challenging because yeah, like as I mentioned, you would try basically to understand what you can do different to get, but
exactly.
at the end of the day, it's not all in your hand. You would do your best, but I think maybe like there are other factors as well.
I totally agree with you, and like some like one should be ready for this. After you get the match results, and if you don't match, like you still have a complete year. You have to ask yourself, what can I do differently? What can I add on my resume? What can I add on my CV? It could be sometimes frustrating. It could be sometimes challenging. It could be like sometimes you find like you find no answers, but like keep trying, keep trying. You never know what's going to change. You never know. And like you did this, taking care of your family, helping your husbands, traveling all over Canada, and you stay. Like you are living example of how being persistent pays off. So what do you think helped you the most? What do you think is like the factor that helped you to get into residency? Or like if you're gonna rank them, it's really hard to say like one specific factor. Like
Yeah. So I try to stay optimistic and didn't really give up. Even though, like in my first attempt with NAC-OSCe, I tried really hard because I knew that this score would be important. But I don't know, like for whatever reason, I couldn't really get the top score that I basically had in my mind and I wanted to get. And like for 2 years I got stuck because their rule was like, okay, you shouldn't repeat the exam and no other chance. But even during that 2 years I tried like to find other options, and I was just thinking, okay, there must be another option, there must be another way. And finally, like after 2 years, if I when I got like the opportunity to redoing my exam, immediately I got it, and I was so motivated to basically study for that. Even like some of my friends, they told, oh, like you are so like basically perseverance, like why, how you can do this again. But as you mentioned, I'm really glad I did it because my second attempt, my score jumped like really high, and it really changed the story for me.
wow,
And the opportunity, yeah, came better. And basically, yeah, I think like being optimistic and like don't give up easily. It's very important.
I agree with you. I agree with you. So what would be your last words for people like who are listening and who are in this process trying to get like what would be your take home points?
Yes, I would suggest like everybody, like it's better believe in yourself, and know that like every IMG has different stories. I really believe in this, and I have seen like this in any friends and colleagues around me. So that's why like if you don't basically follow one path exactly, it may be another path for you. So basically, I would suggest create your own story. Try hard and don't get disappointed if you don't reach your goal shortly. This journey actually is challenging, it's tough, and every other IMDs can totally understand you. But if you want it, like really, you can do it like any other people.
Nice. Thank you so much. I really appreciate sharing your experience, and thank you so much for your time today.
Thank you.
You're welcome. Thanks.